And she is live with more just on the trauma a situation like this can cause. Good morning, Dr. Saunders. Thanks so much for being here.
Good morning, and thank you for having me.
So when something like this happens, the first day, I know a lot of people, their adrenaline is going, but it is traumatic. Can you talk about what's happening just to the community and also to these poor officers who had to witness so much?
Right. So in situations like this, Scott and Kara, what we look at is kind of what's called the disaster pyramid, right? So there's those individuals that are directly impacted by the events. And in a situation like this, there's actually a large community in the surrounding communities that are directly impacted by this event. There'll be so many people in those communities that knew one of these officers or know another officer. So the amount of people that will be pretty directly impacted will be very great. I mean, from there, we look at who's impacted is the friends and family, because they're obviously devastated in situations like this. And then let's think about the medical and rescue personnel, right? The personnel, the police officers that are responding to this, their colleagues. So this is really very difficult. And then, of course, the general public, right? We want to feel safe in our homes. We want to feel safe in our communities. But something like this really rocks our feeling of safety and security. And it has such a large reverberation.
People react differently in situations like this, Dr. Laura. There is really no right or wrong way to react. Is that correct?
Right. There's no right or wrong way to react. Sometimes people, they feel exhausted or tired and they just need to rest. Sometimes people want to keep busy. Sometimes people feel a little bit more emotionally distant or detached. They feel confused or have difficulty making decisions. And again, that may also be not just how closely impacted you are, but by how much trauma you've had in your own life. Mm-hmm. And sometimes trauma like this really stirs up past losses and past trauma. So these are really times to be gentle with yourself, to really just realize that you're having a trauma reaction, and to just do whatever you need to do to help comfort yourself.
Yeah, that's good to let people know if they wonder, why am I reacting so strongly? It really can be because of what you've been through and what it's triggering. If we could just take a moment, this is all over the news, and one of these officers was even a school resource officer. Kids are hearing this as they're getting ready for school, I'm sure. Talk to us about, with parents, how they can talk to the kids, especially in Bristol.
Right. So, I mean, school personnel will address this directly with the kids, especially those that have that sort of first point of contact. Maybe they knew one of these officers, they're officers in the community. And it's just allowing them a reaction. More and more, we don't necessarily do big group events where we tell people upsetting news, because everyone has such a different reaction. So you're always looking to someone else to see how you should be reacting, but more addressing problems as they arise. If someone is, closely connected to one of these officers or the officers' families, sounds like they had school-age children as well, that you can address that more directly. You do a lot of what we call validating and normalizing about how difficult such a trauma is.
Dr. Laura, we always appreciate your perspective. Thanks so much for spending a little time with us on Great Day at 9A.
Please take care.